joining me this morning, a very, very special guest, Jennifer Corns. Jen, for those who don't know you, can you say something about who you are and what you do?
Yes, my name is Jennifer Corns, as you say, and I'm a philosopher at the University of Glasgow. And it is philosophy that I do, but I like to do it at the intersection of a lot of the sciences and medicine as well, for the sorts of things I'm interested in. And lately I've been sort of thinking of those things as all sort of falling under the umbrella of threats to agency. So at the moment, I'm sort of toying with that as a way to capture my interest, but they are pain, affect, suffering, and death is what I work on mostly. And
Pleasant stuff.
yeah. Well, we want to make it better. That's the thought.
Very cool. So what can you say a little bit more about this threat to agency idea?
Well, I just yes, it's just a new way of what I've been thinking about as far as how to put together the way I want to think about my research as a whole and the kind of contribution I want to make. I don't know, you're sort of getting older and I'm more interested in tying the threads together and thinking about how to, put together something bigger and how to see my own work and how it might hang together. So that's just a unifying principle that I've been thinking about lately. Maybe the way to think about what all the things that I'm interested in have in common is that they're threats to a person's agency in various ways. So I've been thinking about agency more and different forms of agency and different threats to different ways we might understand ourselves as agents. That's new work. I could talk about it a little if you want, but I don't think it's the main reason I'm here.
Okay, no, that's very interesting. Yeah, it's an interesting way of putting all the different things together. Yeah. So I've been reading your book a lot lately, The Complex Reality of Pain. Is this book out already, or is it coming out, or what's the status of it?
It's finally out. It came out at the end of January. Yeah.
Oh, congratulations. Yeah, very cool. All right, so I'll put a link to it after we're done here talking so that people can check it out. It's an excellent book. It must have been a lot of work. It really ties together a lot of philosophical and scientific strands. And overall, you argue for what is kind of a surprising package of views, that we should eliminate pain talk from science, but not from ordinary everyday folk theory talk. And then also there's some interesting stuff at the end about the medical profession being a kind of interface between the two, which I found really, really fascinating. But so can you just give us a picture of the overview before we get into the details about how you got led to this way of thinking?
Yeah, so my initial interest in pain happened from thinking about dissociation cases, like I think a lot of philosophers. So dissociation cases are cases when you get some one feature or aspect or dimension, depending on whose language you're using, one part of pain, if you like, without some other parts. So you get somebody reporting pain, but saying they don't mind it, or you have pain in a body part, getting reported in a body part that you don't have, or you have people seeking pain. So these are all kind of cases where pain is going weird in some way. Dissociative cases, you have one bit without the other bit. And that just got me interested in thinking about what it is. And when I started, I thought, like a lot of philosophers think anyway, the bedrock starting place is that whatever else it is, it's a sort of quality of experience. Certainly something that it's like for me to experience when I'm conscious of experiencing it, at least. And that's where I started, and trying to figure out what kind of quality it is and how all of these different experiences that were so different could all have in common this one quality and what to say about them, those cases. And then it just turned out to be a lot more complex than that, which is what led to the title of the book. So in the end, what I started to think was, we have this term, so there's that's the beginning thought. And then the end thought is that we have this word in everyday life, pain. And I think we have a posit in everyday theory. So there is this thing that we say exists in everyday life using the term pain. That is a thing that really exists, right? So I don't want to say that there's no pain. That strikes me as a place that one should only go if there's no other option. There seems to be pain. It seems to me to be pain. It seems useful to talk about pain. It seems to be explanatory and predictive in various ways in everyday life to talk about pain. So I think it has its home in everyday life, and it explains there, it predicts there. But then when we go to do the science of it, what we find, sort of surprisingly, is that there's no one thing that does a good job for us for any of our scientific purposes to pick out as pain. Not only is there nothing that's usefully picked out as pain, I think, for the scientific purposes, but there's no type of pain that's usefully picked out either. That was even more surprising to me. At first I thought, oh, okay, so pain is not a natural kind, is the sort of lingo for a term not useful for science. So maybe pain isn't a natural kind, but there are these types of pain that are natural kinds, that are usefully generalized about for scientific inquiry. And then as it turns out, I think that's false as well. And the reasons for that are that, in short, is that I think pain turns out to be this really complex, idiosyncratic thing that we posit in everyday life. Both of those things are crucial. It's not just that pain is complex, and it's not just that pain is idiosyncratic. It's that the complexity itself, the way the things combine, is idiosyncratic in a way that means it's always going to be more useful, as it turns out, for scientific purposes, to talk about which mechanisms might be involved in your particular token pain experience and generalize about those and target those for treatment, than it is going to be to talk about this complex idiosyncratic thing that in everyday life is useful to pick out, but for science isn't. So that's the long overview.
Yeah, okay. So can I ask about the characterization of the folk theory at the beginning? Because one of the ways you start is by saying, well, we have the term pain, it's real, it's part of our folk theory, we don't want to get rid of it. And we characterize it in various ways. But then I think you want to resist the idea that one of the ways that we characterize it is having a kind of quality that's in common between the various things that we call pain. Is that right? Or so is the folk view, in your view, not committed to there being a kind of phenomenal, what it's like, commonality between the pains?
It's tricky there, and I think it's a good place to press. So I think that the folk view is committed to there being a range of qualities that we consider to be pain. And that's something I want to accept too. But if you say something like, is the folk committed to there being some distinctive quality that all and only pains have and must have, then I think the answer is no. Yeah. And partly because I think folk theory doesn't play that sort of game. Maybe occasionally it does, but I don't think folk theory is in the business of weighing in on whether qualities are distinctive in some way or essential to an experience or necessary for an experience, or that doesn't seem to me to be the folk game, partly because it's often going to undermine folk purposes. And, we got to go case by case, but certainly for pain, I think that's right. I think we're willing to accept a whole bunch of qualitative qualities as being part of, or a dimension of, or an aspect of a pain experience, and not any particular one. I don't think we require some particular quality.
Mm-hmm. Is this something you think like experimental philosophy could help clarify or resolve? Or
maybe, yeah. So I have some doubts about experimental philosophy and what it can do, but I definitely think there's been some interesting work by Kevin Reuter and Justin Sitzma, and I footnote them a few times.
Yeah.
And that work supports what I'm saying. So that work, they take the experimental philosophy on pain reports to try to show, so they think they have a bodily conception of pain. So they think pains are things in the body. They're not experiences at all. They're things in the body. And to think that it's a kind of experience is a confusion. And they think that the data from the folk back that up. And having had many long chats with Kevin, what I think he knows, what I think that data shows, it's interesting data. What I think it shows is that you can push the folk, not surprisingly, to start talking about pain as a bodily thing and to start talking about pain in the absence of any particular phenomenological quality. I think that's right. And I think the evidence is quite nice for showing something like that. And that's the sort of thing that I think, XY can be quite good at showing what can I get people to say. I don't think it's great for getting you to tell you about the essences of things, but I think it's good for showing you, what the limits are for what people are willing to buy and accept in their everyday language. And you can get people to accept that there are pains that don't have pick any quality you like, or any.
So the basic idea then is that you can kind of force people to this conclusion, but it's not evocative of what they pre-theoretically thought.
I mean, Kevin and Justin will say that it is what people pre-theoretically think. What I want to say, and the furthest I think that evidence can anyway take you, is that it's within what the folk are willing to accept. I don't think you have to force them, though. I think force is strong. I think they're quite happy to go. You tell them a good story, and they're quite happy to go along with talk about pain that lacks that feature. But on the other side, which is, my beef with Kevin and Justin is, you can tell them a story, well, they'll go along with it being a mental thing that has a certain quality as well. So, and that feeds into the way that I kind of see, that's part of the reason I see the folk picture in the way I do. I think we're really willing to accept a wide range of states and experiences, both mental and extramental sometimes, as being pains. And then what do we do with that? Does that mean that, well, there's no such thing as pain? That's what some people want to say, right? Nothing could have such contradictory features. I don't want to say that, but we have to grapple with the complexity. I think we have to take it seriously.
Yeah, I think that's one of the major lessons of the science, and it's about time philosophers were paying attention. So I think work like yours is very important in this respect, getting the word out. But so before we get to that aspect of it, I mean, so one of the things, this is kind of comes at the end though, when you're considering like ordinary traditional limitivism, which you want to reject. One of the kind of arguments that comes from like someone like Dennett is that the folk notion of pain is contradictory. And it sounds sort of almost like you're willing to grant partially in the things that you're just saying, that there are these contradictory strands in our folk theorizing about it, but not enough to reject the concept. Or is it not an outright contradiction on your view? And or what?
I don't think it's an outright contradiction. Yeah, I think if it were contradictory, that would be a game over. Then we'd have some confusion that we'd need to regiment out of the theory, the folk theory. So I think if the folk were committed to saying pain is some one token pain is both a mental thing and a non-mental thing, then we'd have a problem. But I think there's no contradiction in saying pain is the sort of thing that often has both a mental component and a bodily component. And sometimes it lacks one of those. There doesn't seem to me to be a contradiction there. So the only way that Dennett can get, and he does it in a few places, but the only way he can get the contradiction is to take the folk as being committed to the idea that pains are essentially something or necessarily something. And I just don't think that's supported by the data when we actually start asking the folk, but also I just don't think at a sort of more principled place, you know, I just don't think that's the kind of thing the folk are up to. I don't think they're interested in giving you necessary and sufficient conditions or essences. You know?
Yeah, so I agree.
Yeah.
But do you think still though that there's a kind, not a natural kind maybe, but a folk kind that's picked out by the term pain?
Yeah, it's just a very wide and splendid promiscuous kind. So it's like trips to the museum or boring meetings, or you know, of which this is not one. Although
that's all. Thank you.
I'm talking a lot, so it might be boring for everyone else. Yeah, so I think there are all sorts of kinds that we might pick out that are very promiscuous. We allow a wide range of features which may or may not be present, and pain is one of those. And I think the only reason it seems contradictory when you first look at it to a philosopher's ear is because we're coming out of this tradition where we've tried to shoehorn it into one specific thing. And then if you get a case where it doesn't have that thing, well, that looks really problematic, as opposed to just accepting the complexity and trying to grapple with it. You know?
Yeah. Okay. Very interesting. I mean, in my own experience, like when you are teaching undergraduates, you talk about phantom limb pain or something, they seem very puzzled by the idea. Like a lot of times they'll ask, so if the pain is in the mind, then is it not a real pain? Like, so it does seem that it's sort of easy to evoke out of them this idea that it's something extra mental, that it's something bodily. And that does, I mean, tend to support like Justin and their kind of view that the folk do have at least part their conception of pain, that it's a bodily thing.
Yeah.
And I don't know, it seems harder to get them to accept that it's a mental thing. Maybe you can get them to accept that, yeah, there are kinds of pains that are mental, but like the pain in your arm being a mental thing seems like it's really hard to wedge that out.
Yeah, that's interesting. You know, I feel like I've taught so much pain that I'm not sure I trust myself about, you know, like what might be the best way to do it, because I think I've been doing it so long now in a way that's dangerous, right? So, but when I do it and they seem to get there, you know, we talk about damage a lot, because a lot of the theories of pain that are dominant are representational theories, and in those theories the pain is a mental thing and what's in the body is damage. And once you give the students this kind of vocabulary and you say, look, when you're in pain on these views, right, there's damage to the body, and then you have an experience of that damage, and oh, that experience really sucks, it's got a suckiness, it's also got some sensory stuff, right, it makes you want to do stuff, that experience has all this going on, but it's an experience of the damage, just like I could have an experience of the cup. And once you give them that sort of language and that distinction, a lot of them are perfectly happy to run with it and never look back. And some of them are not, though. Some of them are like, yeah, but the pain's in my arm. What about the pain in my arm? So, and the fact that you get these kind of splits, or at least I do, you know, when I'm teaching that stuff, I think, you know, often if I take polls at the beginning, which I used to do more than I do now, because I feel more confident about what the sort of general gist is, but, you know, people are split 50-50 about all sorts of things that you might think, if it was part of folk theory that something was essential, they shouldn't be so split, you know? So if you ask them, are mental pains about mental pains, or so-called mental pains. So, I have some work on this supposed social pain stuff that was a big deal in psychology, and then looks like experimentally they've sort of lost the game, so it's kind of gone away. I'm glad I kind of got in there quickly before it, because some of that work was really interesting at the time. But the thought was, look, when you have a heartbreak, is that really pain? Is it pain, or is that just a metaphor? Do we just call it? And the students are split, like right down the middle. So same with the bodily stuff. I think you can push them. You can push them any which way if you tell a good story.
Yeah. But so, I mean, part of me feels like this is kind of evidence that the folk theory is kind of in bad shape, because there's this split. So there is, who are the folk here? Which side do we go with?
Why do we have to pick a side? I mean, why should there have to be tension there? Why does it have to be one or the other, do you suppose?
Yeah, well, I guess if you're talking about, one thing, the pain in your arm, and you get half the people saying it's got to be in the arm, and the other half of the people say it's got to be in the mind, then it looks like there's no real thing that we're tracking here that's unified or coherent, because you're talking about one and the same thing. You're not talking about two different kinds of things here. So
yeah, fair enough. But I think the idea that it's got to be one place or the other is the thing that's the artifact of the philosophy room. So if you take them outside of the philosophy room, say I come to them outside of the philosophy room and I say, God, I have this terrible headache and I've had it. Take a student who says either thing in the philosophy room. And then you out in the world, you say, oh, I have this terrible headache and it's been there for weeks and they keep running all these tests and they can't find anything wrong with my head. And it's really frustrating. It's really puzzling. Nobody is going to tell me in that case that I'm not in pain. I've given them enough of the folk range of things that even though there's no damage there, even the die-hard damaged person is going to really struggle, I think, unless they're really committed to a theory in paper somewhere. They're going, no student is going to say in that case, oh, it's okay, you're not really in pain then. No one's going to do that. And the same on the other side, right? So if you get a case where, gosh, I have this thing in my leg, and every so often it flares up and it hurts me, and now and they know that, and then I'm sitting here with them right now, and I say to them, oh yeah, they say, how's that pain in your leg going? And I say, oh yeah, no, it's still there. It's not bothering me right now, but it's still there. They're not going to go, oh, you're confused. It's not a sort of thing that's in your leg, right? They're going to accept what I say perfectly fine. Unless they're really committed to the idea that, so I think it's only when you try to force someone in a choice, then you do get something that looks like a contradiction, because for different people, for different reasons, who might have picked up different cues as well, or are currently having different kinds of life experiences, they're going to be, feel one way or the other at a time if you make them choose. But in everyday life, I think people are perfectly willing to let it be very, very promiscuous, the concepts. And I don't think that has to be a bad thing. There might be reasons for that that are actually quite useful. That's a case I start to make at the end of the book.
Right. This actually is part of the value of the concept of pain, is that it applies many different places.
Yeah. Because it might be quite really important that I get help when I'm having an experience that could have one of these many things, right? Any one of these many features might be, important that I get attention for.
Yeah. So, I mean, let me just try one more time, because with the headache case, I think that's a very good case. I mean, I know I get migraines and they're the bane of my existence. But even in non-migraine headaches, it still seems like there's a location to the headache. Like, for example, when I have a migraine, I can point to where it hurts, like kind of here where the ice pick is stabbing me, or generally in this area. So I get what you're saying, that it's not associated with tissue damage. And you don't have to say, well, there's something damaged there that's going on, but it seems to me that what I'm trying to press on is that the folks seem more committed to the idea that it's located somewhere bodily, as opposed to being just a mental item, even with experiences of red, they tend to think it's out there. So I tend to think they're mostly naive realists, but does that.
I think
if you separate it from the damage and just focus on location in the body.
I don't think so. So here it's quite controversial what I'm about to say, but if we're talking about the folk notion, the first thing anyone asks you when you say that you work on pain is they want to know, what kind of pain. And in particular, they want to know if you mean psychological pain or physical pain. And so of course, physical pain, by something like definition or stipulation, means having to do with the body and located somewhere and so on. But the folk, most of the folk, and certainly if you talk outside of the philosophy room, are perfectly happy to accept all sorts of nasty experiences that aren't physically located as literally pain. And we might resist against that. There might be reasons to regiment in a way where we don't count that as pain anymore. We call it something else. We call it some other kind of nasty state, or we just say physical pain is a totally different thing than emotional pain. And then I'm going to give you a theory of physical pain. That's what a lot of people who work in pain do. But if we're being serious, I think, about the folk notion, and once you start looking at the fact that you can push people to talk about pain in either a bodily or mental way, I think that we ought to be serious about the folk notion and really taking this wide range of things into account, if we can, if it's useful, which I think if we want to track how they're using it in actual life, I think it is.
Yeah. Okay. So let me ask you, can I ask you about these disassociation cases? Because you talk all about, the lobotomy cases, prefrontal lobotomy cases, pain asymbolia. And so these are cases that you want to present as not being settled by the folk theory. So you want to say the folk theory doesn't really tell us how we should think about these sorts of cases, and therefore we need to appeal to the science at some point. Is that a fair way of characterizing? You're sort of looking skeptical of that right now.
We need to, I wondered who the we is when you say we need to appeal to the sciences. So I think in everyday life, it's okay that we don't have an answer about these, was why I was hesitating.
Okay. But
for treatment, of course, we got to do something.
Oh, so you don't think the folk need to look to the science to understand these cases?
No, I don't think the folk, I don't think the folk need to understand the cases. Yeah.
Okay. So it's just the theorizers who need to look beyond folk theory to understand what's going on.
That's right. Yeah, I think folk theory is pretty good for folk stuff. And then the dissociation cases present problems for specialized kinds of inquiry and theory that where we need a settled answer, which is why, and then I'll pipe down and let you ask the question, but I think Dennett, this is something I learned from Dennett. So when Dennett said, talking about pain, when Dennett says, I've learned a lot from Dennett, but this is one thing. When Dennett says, look, in everyday life, the folk have this mess, and what do we need? We need a philosopher. You can't believe Dennett is saying this, but we need a philosopher to come tell us when it's pain and when it's not pain. And reading it, I was like, yeah, we do need a philosopher to do that. But what if the philosopher says, it's okay for you that you don't know, and you over here, call it this is what you need, and you over here, so if you think of, you need a ruling for every purpose, but you don't need one ruling for all purposes. That's how I think about it. So go on. So when you say we need to look to the science, that was my hesitation on my face.
Okay. Yeah. So I was just wondering you talk about this in the book, but I was wondering if I could get you to say a little bit more about what you're going to say to someone who's going to say, like, the pain asymbolic is not experiencing pain because it doesn't bother them. They're not motivated. So a lot of the core things that we think are associated with pain are missing there. Yeah. They sort of maybe have a sensory thing, but some people want to say, well, they're not rational in some sense. There's something going on there that explains why they would be mistaken and in a way that ordinary persons wouldn't. But you want to say that they are experiencing pain. Is that?
Yeah, I do. I think, but I don't think. I think the most useful thing to do for most purposes is to take them as being in pain. And in particular, I think that's the most useful thing to do for treatment, which for me is the ultimate test case, the main thing we should care most about. And for treatment purposes, I think to say that they're not really in pain is a major mistake. And so for that's the core reason I want to say that they're in pain. But if somebody comes to me, and the reason I took a long pause is, if someone comes to me and says, look, Jen, I'm doing a art project for the museum, which just happens, on painful experiences, and I want to get some classic, typical painful experiences, but a wide range of them. I'm not going to offer up the asymbolic as like a clear case of pain. And if that artist says, that's not pain, that's not what I meant, if I try and they say, that's not pain, I'm not interested in that, I'm not going to try to correct the artist and say, no, look, it really is pain. And the reason you should think so is because, and I don't see that there's any need to do that. So if somebody has some theoretical purpose, some specialized purpose where that's not going to count as pain, then fine. As a matter of fact, it's of course missing some crucial features, as you say. And for that reason, if those are the features of interest for whatever I might be up to, it may be quite appropriate not to count that as pain.
Yeah, so I know you put a big emphasis on treatment, which I think is pretty cool, actually, and an important focus. So that's crucible of theory, treatment stuff, I think is a main focus of your book, at least. And it sounds like your work in general. And I think that's important. That's often, I mean, you recount this one story in the book where you're talking to someone who's unmentioned, whose name is unmentioned, but they say, like, I don't care about treatment. And you're like, what? It seems like a kind of typical view.
Someone I really respect, by the way, which is why I did not say who it was. I think their work is very good. If you're listening, person, because I suspect they are, and we'll read the book. You're mad good.
Okay. Yeah, no, I didn't. It wasn't offered as a slide. It was just offered as like, here's a really different outlook on what the point of theorizing is. Yeah. And you want to refocus it towards thinking about treatment, which I think is worthwhile and beneficial. But it seems a bit strange in the asymbolic case to focus on treatment there. Because if you have someone who's, you poke them with a pin and they smile at you and say, do it again. Yeah. In what sense does that need treatment?
The pronouns are the devil. When you say in what sense does that need treatment, what's the that?
Yeah, the pain there, the thing which is occurring in them. So there's no thing which needs to be treated, it would seem. Maybe the condition in general to get them to experience the awfulness, but if like they're smiling and say, hey, you poke me again, burn me, I don't mind, like doesn't bother me. Let me break my arm to get my keys from behind the couch over here. What is it that's you're saying needs to be treated?
Well, I take it the damage and the processing of that damage and the way that as you say, the condition itself requires all sorts of interventions. It's a horrible condition to live with, but on any particular occasion, you don't need treatment if I just poke you with a pin either. So I take it.
A Band-Aid.
Unless you're a hemophiliac. Well, that's quite a poke with a pin. We're not hurting the asymbolics enough in a way that would in general require treatment interventions. That even in the bad old days, that was a bit beyond the pale.
Yeah.
But of course, when they are in pain, they need help just like you do. That's the point. So and when they come to you and they say, as they might do the asymbolic, they have to be trained to seek help when they're suffering in various ways. So asymbolics, Colin Klein has some nice stuff about this. The work on it, two things. The work on asymbolics is a bit of a mess. So some people really disagree about it in general. But the second thing is the work that looks like the best work we have suggests that these people have other deficits as well, having to do with care of their bodies in various ways. So these people sort of have to be taught to care more about their bodies and so on. And it doesn't seem to me that it would be at all useful for the treatment context. In fact, quite the contrary. If they come to you and say, right, if you've taught them to care and that it's important well enough to look to the damage, and when they have the pain to then seek treatment, if they actually do, that you then say to them, oh, for you, it's not really pain. That's like a huge mistake, right? As far as actually helping them. So they need help as much as anyone else when they're in pain. That's kind of the point. Of course, not from the point of view.
I guess I'm not seeing what the huge mistake would be. I'm not saying you're wrong. I'm just trying to understand what the mistake here is. If they come to you and say, there's a burning pain, but it doesn't bother me, then it seems like you could say to them, well, that's not really pain, but what's the mistake there?
So I take it that if they're experiencing pain in these guys' cases, there's pains and there's pains, right? I guess that's part of the point. So let's say they have appendicitis. And when you have appendicitis, the thing that gets you going and gets you to the doctor is the pain. And not in particular for you, I take it, if you're sort of neurotypical, it's the nastiness of the pain that's playing a big role in how urgently you're wanting to get there and get the treatment and so on. Now for the asymbolic, they've got the pain and they've got the pain I think that's mine, actually. I should make
Oh,
sure.
okay.
They've got the pain. Let me close it. They've got the pain, but they don't have the nastiness bit. But now they've been trained, if we've done a good job, which is very tricky. Let's say we've actually done it, and now they have the pain of appendicitis, which is, notice for asymbolics, still quite intense. It's quite interesting. Their intensity ratings are very similar to ours. So really intense pain. And they come to the hospital and they say, I've got really intense pain. It seems to me that you ought to, from a diagnostic perspective, take both pain reports at least equally seriously, as indicating that me, as the clinician, need to intervene to help you with the damage. Now, I assume that when you say something like, it's not a mistake to correct them, it's because you're thinking of pain not as having anything to do with the damage. It's just an experience, and the experience isn't so bad, and so I don't have to worry about it. But if that's how you're thinking of it, then in a way you're begging the question on me and on the folk and on the patient who says they've got pain. So when I'm thinking about treatment for pain, I'm not just thinking about treatment for affect or treatment or treatment for damage either. I'm thinking about treatment of the whole shebang. So people's motivational profile, some people's motivation when it comes to pain is like problematically out of whack, and pain clinicians have to deal with that. Some people's sensitivity to pain is out of whack. Their emotions surrounding the pain experience, that has to be dealt with. And of course the damage itself and so on. So from a treatment perspective, I think we want to accept the wide range as being on a, if you like, a diagnostic sort of even playing field. And the history of pain suggests that when we don't, that's the big mistake. So of course, normally it's in the other way that we don't. We say that people are faking it. They're saying it's worse than it is, where the asymbolic is a case where it looks like it's not as bad as it is. But in both cases, I think the crucial thing is to recognize that there is an experience happening and that there is a bodily thing happening that need to be addressed from the clinician's perspective. And the word is going to get translated out anyway, on my view. So the for everybody, the word pain should drop out. It's just that it's not helpful for me to ever tell you, that's a folk term, don't you know? Really what's going on is this mechanism needs intervention. I mean, that's just not a helpful, thing to be doing.
Right. But so I see what you're saying, and I agree as far as what you're saying. But I mean, when the asymbolic comes and says, I have this intense pain, because I had appendicitis. My appendix actually burst when I was in high school. So I sort of know from firsthand view, this is terrible pain. But it's not like you're going to give them morphine, or it's not like they should be motivated to be, let's relieve that pain. They should look into what's going on with their body and treat the appendix. But they wouldn't do the same thing they did for me, which was pain treatment to make sure that the pain I was experiencing was alleviated in some sense. So that's what I meant by not thinking that it's not that. So I was using treatment more narrowly to mean treat the pain.
So I don't think anybody should be treated for pain. I think that's a confusion.
Oh, okay. Oh, yeah. I'm often confused. So good. Let's.
No. I don't think that's your confusion. I think that that's a very controversial thing I'm saying. Obviously, that is maybe the most controversial claim of the book. That I think pain is never an appropriate treatment target, and the reasons are. I mean, we're circling around what I think are the reasons for that. So, and it's because I think what treatment interventions do when they do well is target particular mechanisms. So take your morphine case. One problem with morphine and opiates in general, as we're all learning to our detriment and to some people's fun, I suppose, at least for a while, is that they knock out whole swathes of activity. So morphine isn't like a great little pain treatment target. It's knocking out a whole bunch of swaths of activity, and it affects your affect full stop. So if you have appendicitis and you go to the doctor and you report your pain, which is the thing that the doctor now takes as an invitation for treatment, and on my view, and that's what I think should happen for the asymbolic too, they give this pain report. That pain report should be received as an invitation to perform some kind of intervention. Some intervention is called for. And then, of course, the intervention you need is different than the intervention the asymbolic needs. The intervention you need might be different than the intervention I need too, the non-asymbolic. Maybe I've got radically different pain tolerances and thresholds than you. Maybe I've got all sorts of other injuries or respiratory problems that mean I need different interventions. Maybe I need to be able to go to work that day anyway for some crucial, I don't know, reason. Appendicitis is pretty bad, but anyway, you get the point. Yeah. We've got to figure out which kind of interventions to do. And pain doesn't tell you that for anybody.
Right.
So in no case, I think, is the appropriate response, oh, now I'm going to treat the pain.
Yeah, I see what you're saying, and that's the complex idiosyncratic nature of it. So we want to target for particular mechanisms. Would it also be a confusion or a mistake to say that we want to relieve discomfort?
No, I'm okay with that. So I think affect is its own thing, and affect may be a natural kind. So that's the work I started doing after this. It may turn out
Okay.
that pleasant and unpleasant qualities are a natural kind that sometimes need targeted interventions. But morphine doesn't just do that. I mean,
Right.
if there is such an intervention, we don't have it yet.
Right, but I mean, so after I had my appendicitis surgery, they gave me pain relievers. I mean,
Yep.
discomfort relievers. I guess we could more neutrally frame it. But doesn't seem like you would have to do the same thing for the asymbolic. You would just tell them to be careful and stay.
Depends on what kind of pain reliever. So when you say pain reliever, that's a marketing strategy. It's a good one, and there's a reason it works, because most of us have many things in common when we have common pain experiences. Most of us have the full shebang, but different pain relievers have different things in them, and it may well be that the asymbolic, because most of them are anti-inflammatories, and a lot of them have to do with the signal, the prostaglandin signaling that gets done, it dims that down. And so it may well be that the pain asymbolic needs to take a good range of pain relievers post-surgically. They certainly do. And for different kinds of conditions, they would too. Of course, not to target the affect. The affect is missing. So that's not the thing I'm trying to get at with the intervention. But so I don't think it's neutral to call those, I'm sorry to say, to call the pain relievers discomfort relievers. But even though for most of us, in many cases, most of them will also relieve our discomfort.
Okay. Yeah, no, that makes sense. Okay. So I wonder if we could talk about your case against representationalism, which I thought was very interesting. In some sense, it's like the dominant view in philosophy that you talk at both kinds of representationalism. First, that it's a representation of damage in the body, and secondly, that's kind of imperative. A command to do something, and you have interesting arguments against both of those kinds of views. So, can you give us an idea about why are you such a skeptic about these philosophical approaches? They assume simplicity, I guess, is the basic point.
Yeah. So I think so not just representationalism, but I think sort of more old school brute feeling views, or raw feeling views, or any sort of intrinsic non-relational view, they all sort of assume what I call in the book the orthodoxy of simplicity, that all pains have some one quality that's distinctive to pain. And then the job of the philosopher of mind is to give an account of the quality. So representationalism is one account of qualities in general, and pain has been a test case for representationalism for a long time. Armstrong was really exercised with it in the very beginning, for good reason, because I think it is a sort of problem for representationalism. The argument against the simplicity view is a bigger argument, of course. So I think anyone who thinks there's one simple quality has a problem. But one way to show that is to give everyone what they want and then show it doesn't work. So that's one thing I want to do with the representationalist. So the representationalist who thinks that the quality there is either explained by or constituted by some representation of damage. I think the problem is you get the quality, or anyway, reports of pain, and we're granting that it's a quality at the moment. You get reports of pain without damage being represented, and you get damage represented without reports of pain. And the double dissociations are so broad and so rampant that I think that's a real problem. And same for the imperativist. So you need a particular content there. I think, imperativism only came on the scene in around 2007, 2008. Yeah. And Colin's done a great job in making it sound really, really plausible, as Colin does. And Colin Klein, in his beautiful book, What the Body Commands. And, his view is developed too. So in the beginning, the content of the command was a little different, but at the moment, the thought is the command is to protect the body. So when you have a pain, what explains or constitutes, depending on how strong of a representationalist you want to be, that quality is to protect the body. And then pains might vary in the kind of protective action and the part of the body to protect and so on. But the sort of rough grain content is to protect the body. And then again, I just argue that there's too many dissociations. So tell me what the content is, if that's what it is. I can give you all sorts of pains being reported where it doesn't seem like I have any experience of a command to protect the body or any behavioral or linguistic evidence to suggest I do. And the other way around, all sorts of imperatives that I seem to experience or be aware of to protect my body that don't seem to involve any pain. So it's the glut of dissociations against both that I think is the real trouble.
Yeah, so I want to ask you, I have a question I want to ask about this, but can you give us an example of a case of a pain where there's no command to protect the body?
Yeah, I mean, it's tricky. It's tricky to do it without begging the questions, but I think there are quite a lot. So go back to the headache. I don't think I'm aware of any command to protect my head in that case.
You don't think like seeking aspirin or taking a martini is kind of evidence that you are not protecting it, like defending it, but you're protecting the integrity of the head by trying to get rid of the pain?
Well, I'm certainly not aware of myself as doing that. So it's tricky. I think I have a standing, and I talk about this a bit in the book, I have a standing desire, of course, to protect my body. So if you threaten it in various ways, I'm going to take protective action. But remember that the content here has to be at least specific enough to be explaining or constituting pain in particular. So it's got to be that these actions I'm being commanded to take, protective or otherwise, they have to be, it looks like they can't just be any old thing, or else then the dissociation on the other side is going to be even bigger, right? So if pouring myself a martini counts as a protective action, well, then I've got dissociation cases on the other side, you know. Unfortunately, not that recently. I don't have martini stuff in lockdown, but I had a glass of wine last night, and that would do too, I guess. And that wasn't pain, right?
Yeah.
So it's tricky, I think. Just like for the other representationalists, when you try to fix exactly what counts as damage, you have to fix it in a way that it's a scope problem, right? You have to get in all the right things and keep out all the right things. And it's the same for, presumably, it's got to be the same for protective action. So it's got to be that the actions I'm being commanded to take are distinctive enough that those contents only determine pain and not some other qualities. So
right. Okay.
Pouring martinis are going to get in the game. It's got to be something like, and Colin, again, as always, does a quite nice job of giving you a bunch of examples. So I just don't think they work. But things like rubbing and scratching and holding and cradling, you sort of think of these typical things that we do to sort of protect the body. Those are the sorts of things he has in mind. And so, as I say, when I have a headache, I don't feel, I'm certainly not aware of myself as being commanded to do those things. You might think transparency fails. So Manolo is quite convinced by transparency in these cases. He's aware of himself as being commanded to take. So I don't have that. But forget about transparency. I also don't actually take those actions all the time. So it's not like I'm, constantly compelled to, even though the pain might be quite intense, it would be quite weird, I think.
Yeah, I mean, I don't know, because in my own experience of migraines, I certainly do want to kind of rub the area a lot and kind of press on it. But so I grant that there are headaches where you don't have that, so it doesn't seem like a universal thing, maybe. But I wonder, so in this context, what I was curious about when I was reading this, what I was thinking was, would it be a mistake to say that people like Michael Ty, like Colin Klein, these guys who are trying to come up with some kind of representationalist or imperative theory about the quality here, would it be a mistake to say that what they're after is kind of trying to give an account of the paradigm cases of what the folk call pain? And so maybe there's outlier cases and so forth and so on, but there's a kind of narrow core set of cases for which this corresponds to what the folk think.
I mean, that's a cool project, but I don't think that's what they're up to.
Yeah, no, maybe that's not what they're up to, but I mean, would it be a mistake to try for that sort of project on your account? Would it be a?
I think it would be a mistake to think that one representational content could do the work. I don't think it would be, at least I haven't given any argument to think it would be a mistake to think that for every mental component, a representational story could be given. Indeed, I suspect something like that is true myself. I'm quite partial to representationalism.
Okay.
I wouldn't die on that hill yet or anything, but I am. And when I started, what I wanted to work at was a quality space for pain. So, I quite like quality spaces for qualitative character. A la Rosenthal and our shared history. I quite like that stuff. It's the best stuff I know. And when I started, I wanted a pain quality space, and then I think it just fails because, as it turns out, there's more to pain than the quality. But I don't think that shows that representationalism fails. It may well be that representationalism is the right story. So for contents, you have full-blown content, and for qualities, you have representational character or something like this. I think that might well work. But the thing I think is a mistake is to think some one content or some one quality is pain, at least as we understand it in everyday life.
Yeah. So on the quality space point, so you do think you can have a quality space for pain qualities, even if that doesn't exhaust pain itself? I mean, burning pains are more like, less like stabbing pains and throbbing pains. So you think you can, does that work for the sensory quality aspect of it?
I don't think so, as it turns out. So I tried to make it work, and some other people, every so often someone sends a PhD student will send me a thing trying to make it work. I'm sure that some people are still out there doing it, but I don't think it works. And one reason I think it turns out not to work is, as it turns out, I think, and this comes now from looking at it from the other side, from starting on the neuroscience side, what's happening, I think, in paradigm cases of pain, typical cases of pain, is you've got a sensory component you do, and that's coming in a way just as you might imagine it, through somatosensory and through your tissues. So in the paradigm case. And you have quality spaces for those, I think. So you have a tactile space, and you have a space for temperature, I suspect, although maybe it's just a unidimensional one. So I think it's Ben Young and Rosenthal have a nice paper about a unidimensional space and how that could work. I think maybe something like that is what you've got for temperature, and maybe you've got something like that for chemical reception. I haven't yet been able to figure out what I think about whether there's some sort of distinct chemical quality space or how that might work, or whether that's just part of the tactile one. I think we don't quite have enough to sort of work that out. So like think of chilies or something, or those horrible brambles, or when you get this sort of it's a chemically kind of feeling, and there are certain receptors that are sensitive to certain chemicals, and I don't know if that's a distinct space or not, but I do think there are those spaces. But those spaces, notice the dimensions for them will let you take values for all the dimensions that give you something that's just nothing like pain, right? So all sorts of other kinds of touch and temperature sensations, and so that's not the pain space, right? And I just don't think there's any place or role left for one. So you need the affect, you need the sensory bit. I think you typically have the motivational stuff too. So you have some sort of motivational state. So I think that's the sort of reason imperativism looks so plausible. You normally are motivated to do something when you're in pain. Even if it's not constantly rub your head, maybe sometimes rub your head, but even when you're motivated, the motivation goes beyond, I think, just the protective thing. I gotta fix this, I gotta do something. So that's part of it too. So I think you do need all those things, but I don't think you'll get one quality space such that your pain, the quality of pain, is some function of the value of the dimensions of the space.
Okay, so I wonder if we could start talking about the case.
Richard, I feel like every time you ask me, I talk for ages. Are we doing okay?
That's what's supposed to happen. Yeah. I think you're doing exactly the right thing. I want to get you to talk about the case for eliminativism, for scientific eliminativism, as you call it. So it's come up a few times, but I wonder if you could say in more detail. I mean, I think philosophers are most familiar with the gate theory of pain, or at least, I think that's kind of at least amongst scientifically informed philosophers, that's what they think of when they think about the neuroscience of pain, maybe. But you criticize, sorry?
Certainly it was, I think. The neuromatrix is becoming quite popular, I think, for what it's worth.
Yeah, I learned a lot about the neuromatrix from reading your book, actually. So I thought that was pretty cool. I didn't know a lot about it. So, I mean, the basic argument that you have here is that these are cool things. The gate theory, the neuromatrix theory, inflammatory research, all of this stuff, that's cool stuff. But none of it is going to correspond to what we think of as the type pain.
Yeah.
Is that basically the argument? So it's not that we want to get rid of these things. It's just that they are not capturing what we mean by pain.
I think all of them identify briefly or specifically. I think all of them identify mechanisms which may, but also may not be implicated in any particular token pain experience. So they're important in their identification of these mechanisms, and tracing them and thinking about how they work and how we might intervene on them, and the role that they have to play. I think a lot of that work is beautiful work. But none of them identify the pain system or the pain mechanism. And actually the scientists themselves are usually quite careful about that.
And that's, so if there were scientists who read your book, you would hope that they would come to be convinced that, oh, I'll just stop talking about pain. Instead, I'll talk about inflammatory NSAID, or calcium uptake, or sodium gating channels, or whatever. So that's what you hope the upshot of this is. It's just you're gonna change the title of papers.
It depends. So it depends on what they're trying to do. So I think the upshot for me is not just the title change, it's better treatment. And I don't mean to be a dick by sort of like taking some moral high ground about that, but I really mean that. So, and for treatment, of course, I had a really interesting talk with Laura Mosley, who's like a leader in pain management, a few years ago in Australia. And we talked about some of this eliminativism stuff. And he was like, are you saying that I don't treat pain? Like we had this like, and I said, yep, no, that's what I'm saying. If you mean like when you actually act to intervene, is it the pain that you're targeting? And then I asked him, like, do you feel like you can just make someone target on pain? And he was like, well, absolutely not. Of course, pain is very different from person to person. I was like, so we're playing the same game here. But of course, if you mean that the reason to go looking for mechanisms is because we want to intervene to help people with their pain, that's absolutely right. So that's, I think, the point about the medicine being at the sort of interface. On the mechanism side, I think the pain drops out. On the folk side, not only do I think it shouldn't drop out, it's crucial, it's very important. And the reason the practitioner has such a tough job is because they have to, and the reason pain treatment sucks so bad, I mean, and everybody admits it does, I think, is because it's a very hard translation from this promiscuous folk notion into some specific mechanism that we can target. So then when you say, well, what should the scientists be doing? Or well, it depends on what they're doing. So if what they're doing is, look, here's a range of cases that people report, take chronic pain. Let's say I'm a scientist interested in chronic pain. I want to figure out the neuromechanisms. It's perfectly legit, I think, to use chronic pain as a construct to guide chronic pain as reported, and needing treatment in the clinic to guide the sort of mechanisms I then go look for. I think that's a perfectly legit thing to do, and to say that's what I'm doing, right? That's what you're doing. Okay. I think the problem would come if when you identify something, you say, aha, this is the chronic pain mechanism. And as I say, I think actually scientists are generally, unless they're being pushed to publish, certain things, or journalism happens in the way it does and all that. But when you talk to them in their quite serious moments, I think they're usually pretty good about that, It's really philosophers, I think, who have oversimplified pain. And scientists did too, until gate control. So I think that really caused a revolution in the science for thinking about pain as this multidimensional thing. And I think, and as involving a range of different mechanisms in different cases. And I think most serious scientists are now actually pretty good about that.
So you're not against, a scientist writing a grant saying they want money to research pain?
I'm not against that. No, I think that's great. I would be against saying something like, we're going to identify the pain system, the pain mechanism. And there are a couple of scientists who do that and believe that. And I have had a few nasty interactions. Well, some people think that that's what they've done. And I do think that's wrong. By the data, though, not, for some a priori reasons.
Yeah. So, this is the trickiest part, I think, of your work, is this interface between the practitioner and the scientist, because, like you're saying right now, it's legitimate. A person comes to the clinic because they're in pain. They say, I have chronic pain, or I have this pain here. The clinician then has to sort of go, okay, so I used to be a folk or something like that, so I guess I know what thing that you're talking about. But then when I go and talk to the scientist, they got to translate that basically into mechanism talk. So then the pain will drop out, and they say, okay, so this person needs intervention in this particular mechanism, not in the other mechanism. So there is a usefulness to the pain talk, and there is somebody who needs to be fluent in thinking about what the ordinary person is talking about. But on your view, it's not the scientist. But when the scientist comes back and says, here's the right intervention for that, then it would be a mistake for the clinician person to say, what I'm doing is treating the pain, even though that's what you would tell the person, right? Or is this not what you tell the person?
There's a lot in there. So two things. I think what you tell the person depends. And I know that's a dick answer, but that's really the true answer. So people, for instance, who have chronic pain, which is the pain that we're most likely to think of as being a treatment target in itself, are often taught to learn how to, and actually Lorimer, I think, is the best for this, which is why I mentioned him before. Mosley, the best, very, very good for thinking about how to get a chronic pain patient to sort of get underneath, if you like, this experience of, I'm in pain, 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 I'm in pain. And think about what else is going on with the body, think about what to do. So shift the focus and how that can help. So, what you tell a patient, I think, depends quite a lot on the patient. If you are having a root canal, it's probably perfectly good for the doctor to say something like, although even most dentists don't usually do that, they'll say something like, can you feel this or does it hurt? But it would be perfectly legit, I think, for a dentist, to say something like, do you feel any pain when I do this? Or to say, let me know if you feel any pain. That's going to do for us what we need to do. And there's nothing wrong with that. Whereas, for some people, like some chronic pain patients, you do want to get them to stop thinking of what's going on with them in terms of pain, because it's no longer useful to think about it that way. They want to get under that and past that. So I think it depends. I don't think that sort of the way you described it as being in these sort of like quite neatly distinguished silos is a sort of, I know we're just caricaturing here, but that's not, of course, an accurate picture of how this sort of science gets done, right? So most of the people who are doing this research also have clinical practices. There are pain, like a lot of maladies, usually takes a wide range of interdisciplinary investigators. So people who are working on this stuff are generally aware of the clinical context. And indeed, historically, that's what's driven the scientific research is the clinical context, quite rightly, on my view. So it's not like, the science has a completely different vocabulary and the folk have this completely different vocabulary. And then the clinician is the only one who's like able to sort of talk back and forth. I know a little science. A scientist has a nightlife too. People have multiple hats that they get to wear. And so a good clinician, I think, though, forget about pain, just in general, I think a good clinician, is a good person of the people. They're able to sort of understand what people are like and what they're saying in their reports and take those reports and get something diagnostically useful out of it. It's a real skill, that for any condition, I think, involves being able to truck in the everyday ways of thinking, and then also being able to truck in, scientific language that is not, often usefully communicated back to the folk, but that's important for intervention.
Yeah. Okay. So I wanted to ask about the types of pain, because one of the surprising consequences is you might think laughingly, yeah, sure. A pain as a type itself is, I'm happy with that, there not being a pain mechanism, but neuropathic pain, chronic pain, inflammatory pain, why can't we identify mechanisms for these? And that was, I think, one of the most surprising parts of the book, I thought, besides I don't want to be an ordinary limitivist, was that it turns out that you can't find anything that way either in those places either.
Yeah.
So what is it? Just the same? It's the same argument, isn't it? It's just that when you start to look at the mechanisms, it's just too varied. And
Yep. And his as an autobiographical fact, that was the direction of travel. So I started thinking there'd be a quality space, and I could work on the neuroscience and try to figure out how the mechanism for it worked, what was how you got the space going, basically, the receptors and so on. And then, oh, well, it doesn't look like it's just a quality, it's this big thing. And then go look at the pain research, multiple mechanisms, and then go look at specific types of pain. And as it turns out, I think same story. Yeah.
That's kind of a bummer. But I wonder if you
maybe before you go, before you move on from that, to say, I do think that, and this is a point, that I take from Quine, I do think some kinds are more natural than others. And that's what we might expect if you have a kind of utility pragmatic approach to thinking about which kinds are natural, as I obviously do. So I do think it's more useful. You're going to get better generalizations for science by looking at types than pain in general. And some types are going to be more well-behaved than others. There might be particular reasons for that. Some of those might actually be accidental, as I've sort of been thinking about it, sort of spandrel type features of the way that we've sort of picked out different types of pain and culture and that kind of stuff. So some of these types will be more well-behaved than others. And for some, you might get more traction than others. But the underlying argument there, and the reason I think even those should be eliminated, is it seems to me, and looking at the data, that you'll never lose, and that's the sort of crucial point. So if I'm wrong about this, then I'm wrong, I think, is that you'll never lose explanatory or predictive power by replacing references or replacing the generalizations, the focus of the generalizations, to be about the implicated mechanisms as against the pain types themselves. So if that's right, that's the big move when it comes to the types, and the broader kind too, but it really pushes when it comes to the types. If that's right, then I think then we should eliminate it from scientific discourse. So we want to replace it with talk of the mechanism. So we have this folk type, and we have these more specific folk types that we start with. And some of those are sort of half folk, half science, right? So we started looking at pain in general, and we found, inflammatory pain. What's that? And now I go looking at inflammatory pain. That's more restricted. And we sort of fix the reference of the term by having discovered a particular mechanism. So it's going to be more well-behaved, but even those, we class things where that mechanism is sort of associated with the way people report it and so on, but you still get all these sort of messy cases, and you still have complex idiosyncrasy. So you could, those will be more well-behaved because they've been tethered to a particular mechanism, but you'd get better generalizations if you just went for the mechanism. That's the point. Yeah.
I mean, this is one of the ways in which I think that it's more of a thoroughgoing eliminativism than, like, take memory, for example, because I mean, there's a kind of interesting parallel between memory and the sorts of things that we're talking about here, because you start off with this thing in memory, and then you start investigating, you're like, oh, there's like 6 different kinds of memory, and then maybe even more. But still, it seems like you can get a kind of mechanistic account for like long-term memory, working memory, procedural memory. It does seem like it wouldn't be a mistake to say that type of memory, here's long-term potentiation. That's what long-term memory is. I mean, maybe that's a simplification or something, but it still looks like there's a kind of mechanism there that can give you an account of it. But you're saying you can't get that same kind of reductive view for pain types.
Yeah.
Does that sound fair, or do you think the same thing about memory too, ultimately?
No, I think, I'm not an expert on memory. I think it's an empirical question, right? So about what's useful for the generalizations there. So as I see the memory stuff, it looks like what you just said is right. My husband does a bit of work on memory. That looks like the right story to me. So that the type memory is not usefully generalized about, it doesn't project in the way one would like, but that these subtypes do. There's also another, you might have gone pluralist. So same autobiographical story. I thought, we don't have types here. Well, maybe we don't have mechanisms. So maybe we can go pluralist. So we say, look, it's still useful to generalize about the types, despite these differences across the mechanisms. They're similar enough to be usefully generalized about. And I think, as it turns out, as I say, even that is false. It's more useful to talk directly about the mechanisms, and the pain types don't pick one out. Of course, we could introduce a term. I mean, it's just language. So I could say, by pain 568, I just mean this particular mechanism here. I don't know. I just mean prostaglandin release. That's all I mean. Well, okay. But that's not, you've lost the folk, I think, when you do that.
Yeah. So, I mean, I like the folk, I guess, but so I wonder what you would say about, like, so maybe these types that we're looking at are too scientifically oriented in a sense. So maybe inflammatory pain is too much, already got too much of the non-folkiness in there. But what about burning pain, stabbing pain, the sorts of things that people normally talk about, and that show up in the IASP, right? That these diagnostic categories. That is it throbbing? Is it pulsating? Is it burning? Is it aching? So you don't think that we can find a mechanism for burning pain, or that there isn't something in common between all these pains that's going to sort of cash out in the neurological terms?
As it turns out, I think no. So I think what you can find is, to take burning pain, if you like, or what we call burning pain or stabbing pain. I think you can find we're working on it. I think it's coming. I think you can find a pretty well-behaved quality space for tactician. So Matt has a great book about affective touch, which is quite nice. I mean, we're learning a lot about tactician. There's been an explosion of research. So I think you can do that. I think you can work on affect. So that's where I sort of went next. I want to figure out what the affective qualities are in someone, but those things are going to come apart. Right. So, and then you have the Dennett question when they do, is that pain or not? Well, we need a philosopher. Right. And I just want to say about that, look, yeah, it's burning pain. That's a thing. Burning pain is a thing. And if I have burning pain, I typically want to do something about it, and I might need treatment if it lasts. And, but that doesn't mean there's some one mechanism there. Why should it? I mean, I don't need that. For any of my everyday stuff. So I didn't pick something out that, as it turned out, was tracking some one mechanism, And crucially then, I also didn't pick out something that was usefully generalized about. That's, I think, the further step. Those are two steps.
Yeah.
At least for me. For some philosophers, that's one step, depending on your view about how mechanisms connect up to science. That could be one step, but for me, it's two.
So, I don't know how to phrase this, but I mean, so if we take the mechanistic point, which I think is a well taken point. So you're not going to find one mechanism that's common to every burning pain, I guess, is the basic idea. When we look, we don't really find that. But we find one phenomenological quality, right? I mean, we find something there. You don't think we find that? I see. I'm telling by your face. I
mean, look. What's the line? And what a nice beetle it is too. I mean, maybe you find it. I
don't pick a side on me. Oh no.
I just introspection's tricky. So when you say we don't find a quality, I don't find a quality. I find the burny, I find the nasty, I find the motivation, I find various thoughts about the pain. I mean, if it's a pain I'm used to getting or no. I pluck my eyebrows like a lot of people. And when I first started plucking, it's a shocker. And when I first started plucking my eyebrows, it hurt like a bitch, right? And now I'm so used to that feeling. I know when it's coming. I know what it's nothing.
But you can identify the feeling though. And it's the same as before, isn't it?
Don't try to trick me. I mean, the feeling.
I'm not trying to
I don't think there is someone. I mean, if by feeling you mean quality, I can identify the feelings. Some of which have changed, some of which are the same.
Right. So what's changed is like your motivational state and your emotional response to it. You don't think it's horrible or something, but there's something there that's the same between the cases, which lets you identify it over time. I mean, you could say this was there before. I just don't care about it as much anymore.
I don't think it's. I'm not sure I would say it's pain for me at all anymore. That was my point.
Oh, I see.
So the sensory bit feels the same. Roughly, I mean, depending on what else is going on. If I've had a martini, but modulo some things that might affect the sensory awareness. That part seems the same, but the affect is totally different, and the motivation is totally different, and my thoughts about it are totally different. So, is that the same pain? I mean, what are we talking about? I mean, you tell me. What's the purpose that we're picking pain out for? It's the same sensory thing.
Yeah. Yeah, no, so I see what you're saying. I guess I would just, it sounds like I got the answer to the question. You don't agree that there is one thing that we can identify, even from the first person, which is kind of common between things like all of these stabbing pains have something in common. All of my migraines seem to have something in common, I guess I'd say. When I have a really bad migraine, I'm like, oh, there's that damn migraine again. It's not, I don't think it's numerically the same migraine, but I'm like, it's that same quality, that same feeling. I hate it. I could tell when it's coming on. It lasts for 3 or 4 days sometimes. It's just like, oh, that's that thing again. when I stubbed my toe the other day, which happened to me, I was like, oh, there's that pain toe again, that toe pain again. It seemed like the same kind of pain that was there from the last time that I stubbed it. So it does seem, maybe, introspection is tricky, and I have a nicer beetle than you. It's not a good game that I want to play, but it does seem that the ordinary person is kind of inclined to say there's something there that we're latching onto, which we could say was the same before, and which we identify as kind of the painfulness. But you just think that's maybe bad theory that's leading me to think that, or
there's something that I think is a bit two things. So I don't want to say something totally outrageous that it might sound like I'm saying. So let me just make sure you don't think
okay.
I definitely think people are able to, from the first person, recognize that they are in pain. And I even think that from the first person, we are able to recognize that this pain is similar to, in various ways, one I had before. And I even think we're able to do the sort of thing that you were saying, which is to say, so like I have a recurrent pain too. I don't have migraines, thank the Lord. But I have this strange nerve pain. See how I even said nerve pain in my foot, which I went to the doctor for when it first started. All of a sudden, I would just sometimes get this like shooting pain in my foot. It was horrible. And every so often it goes. I would say once every couple months, I'm walking and out of nowhere, I just get this like shooting pain through my foot. It sucks to dig. It's terrible. It's almost as if studying pain, right? Somehow I called upon myself this fate just to like have a little thing to introspect every so often. Anyway, story is too long.
You're dedicated. That's how dedicated you are.
Exactly. God, what is St. Paul has some wound in his side? He says God gave him so he could theorize better about something. There you go. Anyway, so and I like you, I go, oh, there's that pain again. That's actually what I'm conscious of thinking, right? We totally, I think, do that. The thing I think we don't do when we're doing that is what I think we're not aware of, or what I think we're not recognizing again, is some one quality. So we're quite used to that combination of qualities. It's a very similar combination of qualities that I get all the time, in the same way that I might recognize a painting or some other sort of complex experience, and I say, oh, there's that painting again, or they moved that painting. I'm perfectly able to pick out complex, combinations of quality, both in the world and in my mind. If you go in for the introspection beetly stuff and you want to see what it's like for you in there when you go looking, I think we're perfectly able to pick these out. What I think you don't get from introspection, and maybe you couldn't get from introspection, now we're leaving my area of expertise, is whether or not what you're picking out is simple or complex qualitatively. And I think there are these other independent reasons to think that the pain is not simple, that it's complex.
Yeah, and this really puts pressure on views of people who say, there's a thesis which is going around lately. It's people like Philip Goff. I'm not sure if you know about his work or not, but he appeals to a premise that he calls revelation, which is that when you have an experience, you kind of introspect it and you're acquainted with like its experiential nature. You know everything there is to know about it. Yeah. And it sounds like really this is an argument against that kind of view, especially for pains, is that we don't have a kind of revelation with respect to pains. We're really mistaken about their natures, it seems like.
That's interesting, Richard. I don't have some familiarity with that stuff, but not much. But I don't really give an argument against that directly. I suppose in a way. So as far as the book goes, I think that I sort of start out almost assuming something like that is false. But one reason, that sort of sideways reason, that you might get from the discussion there, or our discussion, to think that it's false is, look, how come you think it's complex? If supposedly when I go introspecting, it's revealed to me in all its glory. First of all, we're assuming pain's a quality, so that it's the sort of thing that's a candidate for the Goff sort of move. So, which I don't think, but let's just start, let's say even if it was. When you go looking and when I go looking, it doesn't seem simple to me, it seems simple to you. What's the deal? I mean, that sort of stuff is kind of why, if the history of introspectionism wasn't enough, I'm not particularly excited about that as a project for making real progress. But yeah, I mean, I suppose it's a counterexample insofar as the pain stuff is counterexample insofar as we assume it's a quality, and we assume that people are being honest about their introspection.
What is your general view about theory ladenness of introspection? Do you think introspection is theory laden in a way that some people think observation is theory laden, or do you think
Yeah, I
immune
think,
to that?
yeah. I mean, I could say more, but I don't even kind of know. This I'm sure is my own failing, but the idea that somehow, so I don't know the revelation stuff that well. I know the older luminance kind of stuff better. So Tim Williamson's kind of stuff, sort of my experience is luminous to me in this kind of way. Seems like the historical, sort of more recent historical antecedent besides the sort of really old school history stuff. And that stuff always seems to me to be, just very strange. I don't know what it would mean to just know something. But other people maybe have like more. So I don't, when it comes to observation, I don't know what it would mean to just sort of, I mean, I could have like a stimulation and maybe something similar goes on in introspection, although we need a theory about how we introspect and which mechanism we use to do it. And I suppose I think it's pretty cognitive myself, which is going to be, richly, have rich content, which means it's going to have something like, something like a theory drive in it seems to me. So, and I don't quite understand what the alternative is supposed to be. That's not kind of magical. And I don't mean that in a diss. I really mean, I find it very puzzling. It's a kind of posit that's meant to solve some problems. So in that sense, I don't find it puzzling, but how exactly it's really supposed to work, I find very strange.
Yeah, I think that's a fair point. I agree. But so what I was kind of asking was, though, is like if you sort of start off thinking that pain is a simple quality, then you're going to introspect something like that. If you start off kind of thinking pain is a complex quality, you're going to find something complex there. So do you think that sort of theory ladenness is involved with introspection, so that you sort of, when you're introspecting, your kind of antecedent, your background pre-theoretical views about pain or whatever thing you're introspecting are going to influence what you think you find there?
Yes, I do. I definitely do. But I think, happily for the simple complex point, I think it's not just introspection. So, I try to do this in the book too. We have other kinds of evidence that we get to look to, and behavioral evidence, not just neural evidence. So the way I talk, the way I report my states, the way, the reporting, even the reporting, if I'm sort of not being careful, I might get people to say various things. But certainly the expressing of my pain, I think, reveals, that it's complex in a way that we just sort of assume in philosophy when we start. It isn't, I really think everybody sort of has this, except me. Maybe things will change, but has the starting point of, well, it's a quality, it's a simple quality, and then we need a theory of that quality that is sort of respectable and whatever that means, from your
that's
theory.
the Kripke move, which is just like, what could be more obvious? Like, what are you talking about?
Yeah.
It's a bad way of thinking about pain, but it is interesting that people find that kind of intuitive, which is kind of what the point why I was wondering, like, why would so many people find that? Obviously philosophers love to oversimplify, but it just seems like so many people have ended up with that sort of view, even in the science. Like you said, that was their kind of starting points until they got, more sophisticated neuroscientifically.
So actually that's not true. So in the science, so it's interesting actually about that. I could talk a little bit about it, maybe, if you want the history of that. But so there's, sorry, now I'm distracted by thinking about children and how we get this simple idea, but just put that aside for a minute. So the history of the science.
Boo-boo.
Exactly. And you have to teach them it's not just their body. How does it feel? And that's actually quite tricky. Like, we really don't know how you find it, but my little daughter is just learning about like how to emotionally regulate and what's actually, an owie and what actually isn't. And,
exactly.
He's just walking.
And you can convince them really easy. Like my son was running around the grass the other day. He like fell face first and like plowed his face on the ground and he started crying. I was like, that doesn't hurt. Just get up. He's like, okay. And just started laughing and running around.
That's it. Anna, my daughter, she's been walking for like 3 weeks now, and that's it. And so she's just, it's terrifying, right? She falls into everything. And if I look at all nervous, it's game over. Whereas if I look quite about it, she's totally fine. So I think we do have to, Bennett Helm is really good about us learning about pain and correcting children about it. And so the sort of theory building that, at least if you're remain a folk, that you'll then go on to use for introspecting your pain. I think, we're teaching that in these early years. It's one of the first kind of things we start teaching them. And it's actually quite a complex thing, I think. So So I was thinking about that, but the science history is also actually complex. So there's a nice paper by Dallenbach who does really, in general, I shout out to Dallenbach, who gives these nice histories of different aspects of sort of psychophysical properties and in the philosophy of science side of things that are really lovely. And he has a really nice one about pain. And he says the controversy about pain is the most intense the history of science has ever seen, which I think is overblown. However, it was actually, there was quite a fight about whether it was an emotion or whether it was a feeling, like a quality, or whether it was a perception, where that was a more complex thing. And that debate raged, you know, as soon as sort of you got modern scientific thinking going at all. From then until the sort of turn of the century, really, when the intensity theory started winning, which is also the time you start getting this idea and, you know, philosophy really gaining so much traction, I think. And that theory started winning, where it started looking like, look, the intensity theory was winning. Any stimulation of any kind that was really intense would be pain. And then the perceptive theory started winning, and it looked like we had these receptors, nociceptors in a particular part of the brain. And it looked like game over, that was what was going to win when we discovered these receptors. And then came, you know, the revolution with Melzack and Wall, just blew all that stuff out of the water. So
That's the gate theory, gate control.
Gate theory. Yeah. And so I don't think it was so much, you know, I don't think on the science side, once we actually started doing some science about pain, I don't think it was like from the get-go, everyone was like, okay, so as we know, it's a quality. And I don't think that's the history at all.
Okay, interesting.
Even though in philosophy that seems to be the picture.
Yeah, because one of the things like with Dennett is the way, I know you criticize him, rightly so, I would say, for oversimplifying our folk intuitions. But one of the things that I think Dennett tries to do is, you know, he has this famous line where he says, folk theory is like yesteryear science, like it's the science of yesteryear that's been sort of calcified into the folk. And so it does sort of seem like he's thinking, at least, that this idea that pain is a quality was dominant in the sciences, and that has sort of percolated down into the level of the folk. And it sounds like what you're saying is, no, the history of the science is more complex than that. So even if you take this idea that the folk theory is yesterday's science or whatever, it's still a mistake to characterize our folk theory in those terms as a quality.
Yeah, I think that's right. Yeah. I hadn't thought about Dennett as being sort of committed to that having once been the scientific theory and being able to sort of check his story that way. That's interesting. I hadn't thought about that. But yeah, no, I think that's right, what you say. I don't think the science was that simple, nor do I think the folk theory has ever been that simple.
Yeah. So I want to talk about ordinary traditional limitations. I know we're running. I don't know how much longer I can keep you, but
I have a half hour and I have to go tend to the daughter.
Yeah, no, exactly. So I wonder about traditional limitivism, because one of the very interesting moves you make is like, yeah, we want to eliminate from scientific practice. It doesn't generalize as non-natural kind, it's non-natural in that sense. But we don't want to eliminate it from folk theory. It does a lot of work. It's quite useful. And you resist this kind of move, which I guess I would be inclined to resist less. So I want to know more about this. You resist this move that because the scientific eliminatism is true, that should encroach on our folk theory.
Yeah.
And so one way of thinking about this, I think, is like, suppose, you know, we're just talking about children. Suppose you raised your child, but didn't mention the folk theory, but just the neurological theory. Like all you did ever talk about was the brain. And like you say, okay, so then they fall, and you say, oh, you know, C fibers and alpha fibers and A fibers and so forth. And you never mention pain at all to them, but you just mention the mechanisms. So that kid's gonna grow up not using the word pain. Let's hypothetically, they'd be missing something on your view. There's something that's valuable that would be left out of their way of talking and thinking about what's going on with them.
Yeah, I mean, yes. In short, I don't actually even know how I would do. If I'm right about the situation, one couldn't really do what you're suggesting. So when Anna bashes her face on the wall, when I go back out there, which I'm sure she'll do, I have no idea whether and to what extent which particular mechanisms might be going on to explain her then looking at me and going, it could be one of a range of things. And that's part of why the pain construct is useful. You know, I can sort of tell whether she's in pain. Now, in fact, maybe that's not a bad example, because unless she takes a really nasty hit, it won't be pain. So let's hope that doesn't happen. But let's say she does. Sometimes she does. It may not be the C fibers, you know, that are the trouble. Having various things having to do with the gate being open or closed to pick one mechanism may mean that she does or doesn't have certain sorts of uptake to various other areas in her brain, which is part of why I can then look at her and make her feel better quite quickly. And so, I mean, it's just, I don't even know how we would do the game in this case. That's part of the point, right? Pain is doing something for us that the mechanisms don't. Pain is doing, oh, look, one of this wide range of things might have happened that needs attention, mom. Like, that's what I'm teaching her, right? You've damaged yourself, and oh, you have this nasty feeling, and oh, like you have a sense that something's wrong. Oh, you're worried about your body in various ways. And if we want to let in the psychological stuff or the emotional stuff, which, you know, I have been thinking about how I want to teach her about pain language, and how do I want to teach her that those emotions really are pain. I'm not totally sure about that. I don't know what I think about what's more useful there, you know, from the folk side of things. So some people really want in everyday life to think of those things as pain in the same kind of way. I'm not sure what's more useful. You know, but that's what I'm teaching her, and it's not going to get taught, I think, by talking about C fibers. You know.
So even if we had a full, I mean, obviously we're in an impoverished state and we know a little bit, but not great stuff. But if we knew more, like, you know, so I'm imagining kind of like the Churchland style argument, who I noticed you don't really talk about in the Eliminativism chapter, which is, you know, I'm not trying to take a dig at it, but I just noticed this way of thinking about eliminativism wasn't factoring in. But, you know, Paul is famous for saying things like, Paul Churchland is famous for saying things like, you know, once you learn enough theory, then you readjust the way you experience things. And he says, like, I can actually experience the tilt of the earth, and I look up at the sky and I feel like, yeah, I'm experiencing the rotation. I don't see the sun going over here. I feel myself going around the sun, and these sorts of various things. So you don't think that we can train ourselves to reorient to the mechanisms, like, oh, wait, let me close the gate, and you start rubbing. So you're starting to think about the mechanisms from the first person point of view. And some people think that's a more useful reorientation, even for the folk, but you want to resist that.
Well, no, not necessarily. So, okay, so three things. The first is, I mentioned the Churchlands a bit in the footnote and in the Eliminativism paper and synthese that this is based on, but I didn't want to go down the rabbit hole dealing with eliminativism in general outside of the pain context, because there was so much to do just with the pain eliminativism stuff. And also because I actually, which is second thing, want to take quite a lot of that on board. So I do think that, you know, in the same sort of all my little nods to Sellers throughout, right? So I do think that what we're doing is learning how to build some one overall picture of the world, some one theory. I think that's right. But I think the thing that went wrong, and that I think goes wrong in the Churchlands as well, is the thought that the only vocabulary you need, ultimately, for any purpose, is science. And that just seems to me to be false, and also something that nobody really argues for. So there was a lot of, and that's the third thing, dark nights of the soul, once I realized where I ended up about whether I was a naturalist. Like, does this mean that and you can see that sort of in the end of the book, I guess, when I'm grappling with that, like, does this mean that I think that science isn't the ultimate authority about what exists? That's a big question that I really grappled with a lot. And I think the answer is, well, it depends on what you count as a science. So there's a sort of tradition here, and I think the Churchlands are part of it. Quine as well, and Dennett to some extent too, although Dennett's cagey, of course, in various ways about the realism. Cagey, sophisticated. Where I think what's going on is, you know, where they think that, look, science just is the business of explanation and prediction. And, you know, Pete and I, Mandy and I've had lots of chats about this back when I first started working on this, right? So he's got that view, right? So if you think that that's what science is, then science is, I do think, is the ultimate and only authority about what exists. We want one big theory. It's the scientific theory. That's what we're doing. Fine. But that just doesn't seem to me to be a way of understanding what science is that lets us do the sorts of things that I want to do, the distinctions I want to make. It would just be more laborious, but we could do them. So I could say something like this. You could, if you have that picture of science, you could revise the way I put all the claims to say something like, pain should be eliminated from, now I'm going to list all the sciences, right? Biology, chemistry, neuroscience, blah, 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 blah. But we should retain it because it's usefully explanatory and predictive for folk for everyday life and art criticism and like throw in the other things that we do and care about that might actually involve explanation and prediction. There's a real question about which things do, and you might think that that's the really interesting demarcation problem. I'm not so interested in those labels. I think the thing that's important is that when I'm trying to explain and predict behavior in everyday life, it's really useful. I want to keep it. And then because I also want to be a good naturalist, I think to myself, that makes me think that in order for that to be legit, I mean, think of Fodor and all his like knots, right? Like, okay, in order to rescue the folk, I got to find something in the science that matches up in a way that at least justifies this practice, even if it breaks down into many things, or right. But I need at least something that can explain the determination of this thing. And I really thought that too. So, and I guess I just think, as it turns out, that's just not how it is. And like I think the reason for that, at least in this case, it's not for some spooky reason. So I think each token pain, each time I have a pain, there's some story about that pain that's purely physicalistic and involves, that's my view, I don't argue for that in the book, that involves some activity of perfectly scientifically inquirable bits of me that I could generalize about usefully. That I totally want to, there's nothing in the book that goes against that. And I think that's true. And then there's the question of whether or not all the different ways I can type stuff are going to be amenable to scientific inquiry. And the reason I think pain isn't, and maybe other things from everyday life may turn out not to be, is because for everyday life, I really care about the things that make you, you. And when it comes to pain, it's really important, as it turns out, that's how our, I think, everyday concept works. It's really important that I attend to these idiosyncrasies of you when I'm helping you with your pain. And so you're going to lose that if you move to the generalizations and on a level that will apply to all humans. You're going to lose those features of Richard. So we could do a science of Richard, and then we could keep pain, I think, probably, right? That's the background thought. Maybe we could, maybe your pains are similar enough that we could, I'm not sure about that. That's another sort of step in a way, but that's, I think, consistent with everything I say. How idiosyncratic.
Richard sounds really important to me.
There you go, exactly. Until we do, there's no science, I think, where we want to keep the pain. Yeah, that was a long answer.
So, I mean, part of my reason for bringing up the Churchlands was because, I mean, the way I read them, this is partially an empirical question of whether we want to eliminate these terms or not. I mean, there are areas in their work where they say maybe these folk psychological terms are going to survive because they're useful. Yep. But maybe once we understand the neuroscience better, we'll just see that the folk are better off talking in this way as well. And there's partial transitions already, right? People say, this philosophy is hurting my brain. You know, I saw a sticker the other day, it said H2O polo. It's like, okay, so we know what they're doing. That's already an encroachment where the scientific terms is becoming useful in a way. But so it sounds like, I mean, there's one sense in which what you're saying right now makes me think that you think that's not going to happen, that there's no, that it's almost like not even within the realm of empirical testability or something like that, that we would eliminate folk talk about pain in favor of these more mechanistic.
Oh, golly, versions. No, I didn't. I just said golly. I didn't mean to suggest that.
Okay.
I'm fully on board with the Churchlands about that. That was my first.
Okay.
Totally. I think it's an empirical question. How and when we take vocabulary from one specialized purpose and repurpose it, when that's going to be useful, that's totally an empirical question. And I think it's also, for the record, like, I don't think our folk terms are sacrosanct in that way. Like, some of that might need cleaning up. Maybe some of those should go. Maybe some of those should be replaced for better things we get from some. I'm totally on board with all that. Yeah, totally. When it comes to pain, I feel like the book was an attempt to grapple with that empirical question. So I don't think, you know, half the book is the sciencey stuff. And I don't think that, as it turns out, that we can replace it for everyday use and keep the same explanatory and predictive power. And I also don't think that it's usefully generalized about for what I'm calling science, which you might call particular sciences, and then list them all if you like.
So, but you'd be open to the idea that maybe 500 years from now, people know, like the average person knows enough neuroscience where they would be able to introspect their gate being closed or open, or introspect a certain sodium channel being more active or something like that, and then go to the doctor and say, doctor, there's something wrong with my gating mechanism, as opposed to saying I'm feeling pain.
What I think we know from the science is that, I am going to answer you, but what I think we know from the science is that each token pain is complex and idiosyncratic, with this convergence of mechanisms we have identified. And then we look at enough pain reports and we've learned, shit, you get these very similar pain reports with this very different mechanistic activity that we as the folks still count as pain. That's what I think we've learned from the science. And then you might say, and for that reason, at the moment, I say, get rid of it from the science. But look, we still have all this use in everyday life. Now, it may be that everyday life could change such that we all become much more, fluent in talking about all these different mechanisms. But I do think at that point, our interests will also have needed to have changed in various ways. Our time, the amount of time we have in various contexts will need to change. The reason pain is quite helpful, I think, is because it's, as I say, it gets towards the end. It isn't developed, but if you think about what happens when you're in pain and needing help, right? If the science is right, that every time that's happening, there's many, right? Almost your whole brain is involved, right? In many of these cases, and there's a whole bunch of different mechanisms that are contributing to that experience. It just doesn't strike me as plausible that in most of those cases, when the pain report is useful in everyday life, it's going to be as useful to say something like, okay, and I'd have had to learn how to do quite a lot of introspecting I currently can't do, but let's say I do. Okay, there's this chemical signaling happening over here, and there's this sort of firing over here, and the neural connections between these two are very strong today in this way, such that this kind of a thing, and oh, this happened yesterday, because memory feeds in seriously to pain in a way that's crucial, right? I just don't see it being plausible that in the moment where it matters for pain, that's going to be particularly useful. Of course, it may be for other bits of our folk life. It may be for some pains and not others. I mean, it may turn out that, but at the moment, it's very hard to see, given the data about what's going on and the wide range of cases that we embrace with our everyday term, it's hard to see how that's going to be as good at replacing it,
Yeah.
But
okay,
I'm still to it. Totally. It's an empirical question. Yep, totally.
Okay, we're running out of time here, but I want to ask us about a couple of more speculative sorts of things. So one is this thing that kind of occurred to me while you were talking at the very beginning of our discussion about threats to agency. Yeah. So I wonder if, excuse me, if you can't try to build a kind of content for the representational account of pain out of something like that. So maybe what pains have in common is this threat to agency thing. Or do you think that's too broad of a category because there are other non-painful threats or so?
Yeah. I think it's too broad. So at the moment I'm working on a theory of suffering that says that. So fingers crossed that paper will finally go out sometime soon. But yeah, suffering as significant disruption to agency. That's the kind of view I want about suffering. And I just think there are lots of kinds of that aren't pain. So if you think about intense boredom or hunger or fear, or I could list horrible things. We've all got enough horrible things right now. Maybe I shouldn't do that.
Yeah, exactly.
You know what they are.
Hunger's interesting though. I mean, we describe hunger pains.
Yeah. Sometimes hunger is pain. I think that's okay, but not always. And sometimes it's still a significant disruption to my agency in a way that I want to say I'm suffering from hunger, but I'm not in pain, I think.
Yeah.
Yeah.
Okay, so it's the same argument's going to apply, but not in the case of suffering. It sounds like for suffering, you're going to give a kind of unified account.
Well, I'm working on it. We'll see. So I think at the moment, how I think it might. I mean, there are reasons for that. I don't know that suffering is as widely, the way we use it in everyday life is quite, I think, rife for being tightened up and helped. It's almost like a dangler. It sort of hangs on to talk about pain in a way that I'm not sure is usually doing much additional work. I mean, I think it's interesting the way we think about it in daily life, but the thought is that it would be useful to sort of put it in a basket of, is that children, family? Hello?
Yeah, no, I'm getting the timer, yeah.
Yeah. So last on this, I think the new thought or the new way to try to think about it is that we might have different forms of agency. So you have like what you might think of as biological agency, social agency, psychological agency, and you can get these different kinds of suffering. So in a way, you're getting still this sort of hopefully the kind of nuanced picture that I think we actually have of the ways that we might suffer, but that all of them can be understood as these significant disruptions to agency. That's the new thought, coming from thinking about the pain stuff, you know.
Interesting. Yeah, I'm looking forward to see that project. And then finally, I want to ask, this is really speculative, but I mean, it sounds like I maybe know the answer that you're going to give from what we've been discussing, but I wonder about what your views are generally about pain in non-biological systems. So can we build a robot that experiences pain? If we gave it the same sorts of mechanisms, would it come up with the same folk theory that we have? Is it ethical for us to do that sort of thing? So I'm just curious about your views on that.
I mean, I definitely think that you could, for all I can tell, you could build a robot that could have everything that we have. So you could build a robot such that it was useful to refer to it as being in pain. You could give it all the mechanisms we have, and how idiosyncratic it would be, I think, depends in a way on how we make the robot, right? And so that's I think a sort of tricky bit about how different it might be from us, or how different they might be from each other. That's a sort of programming question, and you know, that we would want to work out. Whether, of course, the pain of such a creature would be well, we created it. Create of such a thing would have the same ethical standing as us is a separate question, you know. That's a deep one, but I don't see why not.
So
I mean,
you think
I mean, what makes pain bad, I think, is a real, on my view, is not that it's pain as such, because any of the components might be different. So I think you can have some pains that maybe are not bad for you. You can have some pains that are not bad to cause. You got to think about, but most pains are bad for you, and they're bad to cause, and they're bad for your body, and right. You kind of have to break it up.
So phenomenologically, you think the robot would be similar to us?
I mean, I don't see why not. Yeah.
Yeah. And it would even maybe describe itself as feeling pain, be able to talk to us in that way. And we would be able to say, aha, well, we'd intervene in those same sort of ways, looking for the mechanism and so forth.
If you gave it the right theory, it would introspect.
Yeah.
Yeah.
So you'd have to teach it like you teach, you know, to kind of
or whatever.
Take iCub.
Yeah. I don't know how you, it depends on the robot, right? Whether and what kind of training you give it. But so long as it worked itself into the right theory, it would give you the right introspective data, I think. Yeah. That's just part of that physicalist picture, right? That's why the token claim about pain, I think, is really important for me. Every token pain is still explained and determined by the activity of the system. That's right.
Yeah, I mean, for myself personally, I'm kind of more leaning towards a biological account. So I guess I'm more skeptical that you can have, even if it functioned the same, I'd be more skeptical that it felt pain.
What's missing?
But something biological. But who knows what? I don't know. Maybe it's calcium. Who knows?
Okay.
But yeah, I'm kind of anti-functionalist at my core.
Right.
But that's just, you know, that's. But I do feel like maybe when you talk to neuroscientists and you really get down to it, a lot of them are functionalists, but not all of them. Some people really think there's something. One of the thoughts is that if you build the mechanism, eventually it'd be so complex that we would call it biological in some sense. It doesn't seem to me that you get away from, but that's not really what I was trying to press at. What I was trying to get at was, so if we could design this, because let's entertain that we could do this. I think it's at least conceivable. So we could build it to have a pain mechanism. So there's nothing about or pain itself. I mean, another way to put the point is that it's kind of accidental feature of us that these mechanisms are so disparate. But there's a conceivable creature which did have a pain mechanism in the way that maybe the philosopher thought we would have had. Or now you look very skeptical. So
I'm not quite sure how we got there. So here's how I was thinking about it, and then tell me how we got the pain mechanism out of it. So I was thinking you could make a robot that has all the mechanisms I have, whatever those are, and whether we understand them functionally or biologically. I mean, turtles all the way down or whatever. You give me your biological thing and I'll functionalize it. But okay, so it's got the stuff in it, and then it's got all the stuff I've got, and then it mechanistically, and then I take it, because I am a little physicalist perspective, I don't have arguments for this, but I then take it that it's going to be subject to the same sort of theory that I am. So it's going to be useful to explain its behavior in the same ways. And it's also going to be true of it as it's true of me, though, then I take it that it doesn't have the pain mechanism. It's got a bunch of mechanisms that sometimes converge in a way that it's useful for everyday purposes to refer to it as pain, just like I do.
So we could build a system like that, but couldn't we also build a system that had one canonical mechanism that produced these things called pains, and which it would be useful to describe in that way?
Not if
So is
pain.
there something? So is there something about pain itself which prohibits that? I guess is what I'm asking.
Yeah. Well, when you say pain itself, is there something about the wide and varied group of things that we use the term pain to refer to in daily life that resist that? Yes, I think so.
Okay.
Because once you stop talking, once you fix it with some one mechanism, you no longer have this promiscuous thing that I think you have. I mean, I suppose you could build a robot. You could build a robot to have one and only one kind of experience that ends up getting to do all the things that some paradigmatic pain does. You could do that, I suppose. That creature, of course, that robot wouldn't be like us. But you could like make a little thing that has a paradigmatic pain because you programmed it that way. Maybe you could do something like that. I haven't thought about that. If you see what I mean, it wouldn't have.
Yeah, I do.
Its pain would be, it wouldn't have the full range of pains that you and I have. But you could maybe build something where it's got this bit and this bit and this bit and this bit and this bit. It's got all the paradigmatic features of the thing. Every time I turn it on, you could do.
Yeah, so that's interesting because it sounds. I mean, the way I was thinking was that it's kind of accidental feature of us that it turns out to be so different. But all the things that we call pains and all their different variety and glory could have turned out to have one mechanism, which was the explanation. That's what motivated your beginning research and idea. Just sort of empirically turns out that's false, but couldn't it have also empirically turned out to be true?
Yeah, I mean, there's a sense of code in which that's got to be right. I mean, yeah, totally. If it's a yeah, there's a sense of code in which that could have turned out to be true.
But it's not merely an epistemic sense, hopefully.
I'm not sure, Richard. My hesitation is that it depends on how we're doing the reference fixing, is my hesitation. So if I think about in everyday life, the term pain picks out something that is extremely promiscuous. So what's going on in my mind is thinking, could you have a mechanism whose activities were this promiscuous? I guess you could, but so yeah, there's some sense of could there. Would that be the kind of mechanisms we find in creatures like us? I start having a bit of a problem about exactly what would have to be involved to give mechanistic activity the same sort of promiscuity that we have. Because when I think about a mechanism, I think about a thing with, I tried to be very liberal about it. There's a thing with a whole with parts that does something that determines the thing I'm interested in. That's a mechanism for something. Mechanisms are mechanisms for. And if I think about a mechanism for pain, it's got to be well behaved enough that I can pick it out as that mechanism. And then I wonder if something so well behaved is going to be able to play the role in everyday life that pain, as a matter of fact, plays. Maybe you'd have to have quite a promiscuous kind of mechanism that I think is not like ours.
Yeah, interesting. Yeah.
Does that make sense?
All right. So it does make sense. I want to ask a lot of other stuff, but we're running out of time. And this could go on for thousands of years, but we got to end this at some point. I do want to ask at the end, final question, if there's anything which you were hoping would come up in this discussion that hasn't come up. And the answer can be no, but I like to check.
No, I don't think so. Yeah.
Okay, good.
Let me say this quickly. Because it's a consciousness blog, I should say, I was surprised there was no consciousness chat about the pain. Let me just say, I think, because people interested in consciousness might be interested to know, I think everybody working in pain thinks there are non-conscious pains. So it's a little plug for people working on consciousness to maybe not do as they sometimes do and take pain as the experience that's like, oh, necessarily conscious. Every pain person is like, what are you talking about? So maybe give an example. Can I end with a note like that on consciousness?
Yeah, absolutely. No, I'm glad that you brought that up. I was going to ask about unconscious pains, but then I figured you never mentioned it in your book. So, maybe.
But on this particular channel, I felt I should say something about it.
That's good. Thank you. But on that note, though, the folk seem really resistant to that idea. That's not part of the platitudes of the folk, do you think? Or what?
I think that the folk think that pains are typically conscious, but as in some of Kevin and Justin's work, they'll go along with pains that were there all day that you weren't aware of. And for me, that's non-conscious.
Yeah.
They'll totally buy those. Yeah.
I mean, now, just real quickly, do you think so? Do you think there's room for a bifurcation view here where the word pain is ambiguous between the mental conscious experience and then the bodily thing itself? So in the way that, like I think the word red is ambiguous in this way. Sometimes we mean red object. Sometimes we mean red experience of red. Both are equally good uses of the word red. It's kind of pointless to argue about which one is really red, the flower or my experience of the flower. They're both, red in a sense.
Yeah.
Do you think the same could be said of pain as well? That so maybe what you're doing with the folk is pushing, just disambiguating the notion in a sense?
I mean, this is Chris Hill's view for the record, so that's his view, and he has a nice little accessible piece on it in that Rutledge volume I did, putting together different views on pain, and it's a
Yeah,
nice.
that's a great book.
Thanks. I think it's a nice move. I mean, I can see why it's tempting. I don't think it works. I don't think it does what it's supposed to do. Not least because I think the folk think of pain as involving both of those things. I don't think you get the kind of, if you could start getting serious about the semantics, I don't think that these things behave in the way that they're supposed to. That's the short answer. I don't think it works out. Plus, to make the utility point again, because that we've gone into quite detail now, it's not useful, I think, to separate them out in that way. So when you tell me I'm in pain, do I say, well, do you mean there's something wrong with your body? Or do you mean there's something wrong in your mind? Or do you, I mean, why are you doing that?
Okay. All right. Well, on that note, thank you for mentioning the unconscious pain thing. I think it's good to know that most scientists think that there is unconscious pain because most philosophers find it really absurd. I mean, maybe that's changing a little bit, but a lot of people you talk to are like, pains are necessarily conscious. Like, what do you mean by pain if it's not conscious?
And people has an experience too, which doesn't help. I mean, that even though, so they say that, but then in actual practice, I think everyone accepts that there are these pains that you're sometimes not aware of.
And that they still have all the qualities of pain, like all the stuff there, but just with it, without it being conscious.
Well, when you say all the qualities and all the stuff, we're back in the weeds and we gotta go. But it depends. Yeah. It depends. I think that depends on who you ask. That depends on who you ask.
So that's not common. So it's like you can't have the paradigm case of a pain, but not have it be conscious.
That's right.
That's not common.
That's not common. Yeah.
Yeah. So when you say that they're unconscious pains, what you mean is something like there's a bodily disturbance I wasn't aware of, or something like that.
Well, that's not what I mean. I think you can have all the full shebang and just not be aware of it. But that, and I think most people working in pain in philosophy also think that. I think there are very few people, like, anyway, the people who sort of focus on pain as such and not focus on qualities or consciousness, I think all those people think that's what Colin and David and Marat, everybody working on pain accepts that you could have all of it and just not have it consciously. However, so far as I know, I think that's right. Maybe Marat sometimes flirts with the other idea, but if you ask him in person, asked him, he thinks you can have non-conscious pain. But
okay, well, we'll have that.
Yeah, no,
I got to let you go, but we got to have a whole separate session now on conscious pains, unconscious pains. Okay. All right. Thanks again, Jennifer. I have to say your book is wonderful. I hope people read it. I think it's really quite an achievement. I think that it deserves wide attention. I learned a tremendous amount from it and from talking with you today. So thanks a lot for joining me.
Thanks. Okay.
And just hang on for a second. I'll say bye off air. But all right, let's end this. I never know officially. There we go. Okay, so we're officially off the air now.
Okay.